2 years ago tomorrow, President Obama signed the Patient Protection and Affordable Care Act into law. It was the greatest single step in generations toward ensuring access to affordable, quality health care for every American, regardless of where they live or how much money they make. Millions and millions of Americans have already felt the benefit of this law. Seniors are saving money, millions and millions of dollars, on their prescriptions and their free checkups. The donut hole is rapidly disappearing because of this bill, this law, I should say. Insurance companies can no longer set arbitrary lifetime caps on benefits, putting millions of Americans in one car accident or heart attack away from bankruptcy. See, Mr. President, what they would do is you thought you were in good shape. You had an insurance policy, a health insurance policy, and you get in a car accident or you get cancer or some other dread disease, and you're in the process of being taken care of, and you're told your bill's not going to be paid anymore. Your limit was $10,000 or $50,000, and they stopped paying the benefits. Under this legislation, that can no longer be done. That's why the President signed the bill. Under this legislation that is now law, children can no longer be denied insurance because they have pre-existing conditions, a protection that will soon extend to all Americans. And in 2 short years, in fact, it's less time than that, virtually every man, woman, and child in America will have access to the health insurance they can afford and vital care they need. Mr. President, they will have the same kind of insurance you and I have, basically the same insurance. And for people to rail against this plan of President Obama, as they call it, I haven't seen a single one of the Republicans that rail against this law say we don't want our insurance because it's government insurance. Every member of the United States Senate has the same insurance that we, by law, are giving to everyone in America. My Republican colleagues who berate this bill, let them drop their government insurance. They hate this so much that we're trying to give the American people, have them drop what they have, because it's the same thing, basically. No longer will hundreds of millions of Americans live in fear of losing their insurance because they lose their job. And no longer will tens of millions rely on the only care they know exists, an emergency room. The most expensive care in America is an emergency room. Some people go without care because they have no insurance at all. Mr. President, this is not just a story I've heard from other people. Now, there are people who today have no insurance, just like my family had no insurance when I was growing up. Mr. President, we didn't go to the doctor. We didn't go to the doctor. No insurance. The only time that I can remember going to the doctor was when I was deathly ill, literally deathly ill. My parents had no car, and I had something wrong. I'd been sick for a long time. And my brother had somebody visit him, and my mother asked if they would be good enough to take us over to the hospital, which was 50 miles away. And they did, and I had a growth on one of my intestines or something, and I was very, very sick. Mr. President, there are many people today just like I was as a little boy. They have no insurance. And they may be looking the same as me, to have, with no transportation, have a visitor take them to the nearest emergency room. That's what happened to me. The problem was our emergency room was 50 miles away. Unfortunately, Republicans continue to target the rights and benefits guaranteed under that law. If Republicans have their way, insurance companies will once again be allowed to deny care to sick children because that child has asthma or diabetes or some of the other situations that young people get. In Nevada, thousands of children with pre-existing conditions would once again be at the whim of insurance companies that care more about making money than about making people better. If Republicans have their way, young adults just out of college would be kicked off their parents' insurance plans. Mr. President, also that's something that I know exists today. Little town of Searchlight, where I have my home. A young man named Jeff wanted to go to school. He started at community college, doing pretty well. And he got pain in his groin. First it started out as a little ache, and then it got where he couldn't take it anymore. But because he was at an age where he was no longer able to stay on his parents' insurance policy, he didn't know where to go. So he went to the so-called county hospital, indigent hospital. He was diagnosed with having testicular cancer. He had been on his dad's insurance policy, but he arrived at an age where he was no longer eligible. His parents had certainly not much. His mother worked part-time at a post office. His dad had worked at a steam generating plant 50 miles away from Searchlight. So they begged, and that's stretching a little bit, but they borrowed and borrowed and borrowed to take care of his 2 surgeries, number of hospital visitations, chemotherapy. They paid for that. Thousands and thousands of dollars that they had to find a way to pay for their boy. Under the law that's now in existence, they could stay on their parents' insurance policy for 3 or 4 years more. Allow many young boys and girls to go to college, go find a job. They can stay on their parents' insurance policy. In Nevada, thousands of children with pre-existing conditions would once again, as I've indicated, be without the ability to be taken care of when they're sick. Almost 23,000 young adults in Nevada would once again have to defer their dreams to take a job, or as I just indicated, go to college, or risk going without any care. If Republicans have their way, seniors will pay more for prescriptions and checkups. We've had about 250,000 Nevada seniors who have now get wellness visits, cancer screenings, and other preventive services. This bill goes away. Won't happen anymore. Tens of thousands of seniors who saved millions and millions of dollars in Nevada alone on prescription drugs last year will once again be forced to choose between buying food and buying medicine. If Republicans have their way, taxes will increase for small businesses, and so will the deficit. Repealing health care reform would add almost $1.5 trillion to the federal debt. Not billion, trillion. When Democrats undertook health care reform, it wasn't just about saving money. It was about saving lives, and we did that. And while the numbers I've just discussed are very important, there's one number that matters more than all the others: 45,000. Mr. President, in the year 2011, 45,000 Americans died because they lacked health insurance. That's almost 1,000 a week. That doesn't include the tens of thousands more who are sick or dying because they have health insurance but still can't afford the care they need. After the rest of the Affordable Care Act has taken effect over the next 1.5 or 2 years, no American will have to bear what President Lyndon Johnson called, and I quote, "the injustice which denies the miracle of healing to the old and to the poor," end of quote. President Johnson knew that living in a country with the best medical care in the world doesn't matter if you can't access that care. That's why almost 47 years ago, he signed Medicare into law. On that day in July, President Johnson celebrated an American tradition that, quote, "calls upon us never to be indifferent toward despair. It commands us never to turn away from helplessness. It directs us to never ignore or to spurn those who suffer unintended in a land that is burning with abundance," close quote. So, Mr. President, we saved $500 billion in wasteful programs and other things. And Medicare, we extended the life of it for 12 years and gave seniors the things that I've talked about today. Filling the donut hole, prescription drugs, wellness checks, and all the other things that are so important to them. The Affordable Care Act continues the tradition that President Johnson celebrated because it calls upon us never to be indifferent toward despair. It commands us to never turn away from helplessness. It directs us to never ignore or to spurn those who suffer unattended in a land that's bursting with abundance. The law makes certain that the richest in the nation, this great world of ours, never again turns its back on despair, helplessness, and many times hopelessness and suffering of the least among us. And it guarantees that no insurance company will ever again be putting a price tag on human life.